Hello, everybody. I'm Anthony Gonzalez, and I'm joined today by my colleague Logan Davis, and we are with the Higher Education Center for Alcohol and Drug Misuse Prevention and Recovery. And we want to welcome you all today to our webinar titled Communities Talk About the Value of Communities Talk and Other Prevention Initiatives for Institutions of Higher Education Professionals. Before we get started with today's content, I do just have a couple of housekeeping slides I'd like to share with everyone. Here on the screen should look familiar as we are in the Zoom webinar format. We do welcome your questions at any time throughout today's session for our presenters, but we ask that you use the Q&A feature. We do have the chat enabled, so feel free to introduce yourself and where you're joining us from. We do ask that you utilize the chat to share resources and reflections from today's content, but again, putting those specific questions in the Q&A box. We do have live captioning available for today's session, and you can turn that on through your bottom dashboard. If you have any issues setting that up, please send me a chat message and I can walk you through that process. We encourage everybody to learn more about becoming a member of the Higher Education Center. You can learn more about the different benefits and the different tiers and the benefits that go along with them by visiting our website at hecaod.osu.edu. We also have a few upcoming events I'd like to share with everybody. We have a webinar happening next month on April 13th, and it's titled Using Data to Inform Prevention Planning, and it's featuring Dr. Karen Moses from Arizona State University. We also have the 2023 national meeting taking place June 25th through the 28th, and will be taking place in Columbus, Ohio. If you're interested in registering and receiving early bird registration ends March 17th. And with that, it is my great pleasure to introduce to you today our presenters. Joining me today are Marion Pierce, Public Health Analyst with SAMHSA Center for Substance Abuse Prevention, Richard Lucey, Senior Prevention Program Manager with U.S. Drug Enforcement Administration, and Dr. Holly Hagle, Principal Investigator with SAMHSA's Prevention Technology Transfer Center Network Coordinating Office. Thank you all for joining me today, and it's my pleasure turning it over to Marion at this time to get us started.
Good afternoon, everyone, and welcome to Communities Talk About the Value of Communities Talk and Other Prevention Initiatives for Institutions of Higher Education, or IHE professionals. As Anthony mentioned, today's session will be recorded, and we will be monitoring the chat. So if you have any questions for me or the other panelists, please write them in the chat box at any time. Next slide. So today's speaker, I will start off with details from SAMHSA, followed by Rich Lucey with who will present for the DEA, and Dr. Hagle will present for the PTTCs. Of course, we have to talk about learning objectives. So in this session, we hope that you'll learn about how IHEs can participate in Communities Talk 2023 cycle and host your own activities. Communities Talk Prevention, we will talk about Communities Talk Prevention resources and materials specifically tailored for IHE professionals. Also preventing drug misuse among college students from the DEA, and also learn how IHE prevention resources and strategies are available through the PTTC Network. So I like to start off with data. So I'll share some of the most recent data around substance use and alcohol use among full-time college students. SAMHSA released the 2021 National Survey on Drug Use and Health, or NSDUH, which provides nationally representative data on the use of alcohol and drugs, substance use disorders, and more for those aged 12 and older in the United States. So NSDUH estimates allow researchers, clinicians, policymakers, and the general public to better understand and improve the nation's behavioral health. As noted on this slide, almost 20% of full-time college students reported having a substance use disorder in the past year, and almost as well as 13% reported alcohol use disorder in the past year. It is also important to look at the trends in marijuana and alcohol use in the past month for both males and females. Roughly 20% of both males and females reported marijuana use, and more than 50% of females reported alcohol use in the past month. Now, these findings from the NISDA reinforce that both alcohol use and substance use are prevalent among college students, and that is vital to focus on prevention efforts on college and university campuses. Next slide, please. So this is one place where Communities Talk fits in. Communities Talk is a program run by SAMHSA to support community-based organizations, institutions of higher education, and statewide or state-based organizations in holding prevention efforts, events, and activities. These events raise awareness and educate communities about the harmful consequences of substance misuse, as well as underage and problem drinking in youth and young adults. And it also encourages communities to mobilize to take evidence-based prevention actions. Thank you. So since Communities Talk began, thousands of community-based organizations, IHEs, and statewide or state-based organizations have hosted their own prevention events to better support communities in their prevention efforts. Since 2021, Communities Talk has been able to offer $750 planning stipends and will continue to do so in the current or 2023 cycle. Registration for the 2023 cycle began on January 3rd of this year. There are 500 stipends of $750 each. So CBOs and IAGs need to act early, as stipends are offered on a first come, first served basis. And Communities Talk has evolved and will now take place every year. And another cycle will begin in January of 2024. We hope that this will encourage communities to carry the momentum in their prevention efforts from year to year. We also encourage organizations to continue their prevention work even if they do not receive a stipend. Communities Talk has also expanded to now include conversations about substance misuse and prevention of substance use disorders, as opposed to focusing mainly on underage drinking as it had done in previous years. Next slide, please. So to get you started in the Communities Talk process, I'll review how you can participate in Communities Talk 2023. It's 3 simple steps. The information is available in our Quick Start Planning Guide, which there are links in these slides. And the 3 steps to get you registered are to register, to complete your activity details, and to share your success stories. Next slide, please. So step 1, register. You'll need to receive an email invitation from info@stopalcoholabuse.net. Past participants of Communities Talk will automatically receive an invitation, and those new to the program can request an invitation by emailing info@stopalcoholabuse.net. Once you've been invited, you'll want to complete your online registration so you're able to apply for a planning stipend. It's also important to know that answers to frequently asked questions are available at stopalcoholabuse.gov/communities talk. And you can review each step of the process in our quick step planning guide. We try to simplify the process for you. Next slide, please. So now that you're registered, you want to start planning and promoting your event. After you register, we try to have many resources available to you. They're at stopalcoholabuse.gov/communities talk. That can help your college or university while you get started in this process. Some of the tools that are available to you include an event planner app, a calendar, and success stories from previous activities. Next slide, please. So once you've registered, you planned your event, now we want to, pardon me. Once you register, you can see, you can share your outcomes. The Communities Talk website features nationwide activities map with details from every state. So you can go to your state and update your activities so that others in your communities can participate. And we're always looking for new ways to amplify your prevention successes. So please keep an eye out for an invitation to share your event story. And also you might even be featured on the Communities Talk website. Next slide, please. Success stories. So on this success story tab, you'll see some examples of successful communities where you can visit the once you visit the success story tab of the Communities Talk website. Next slide, please. Our podcast series. I would like to invite you to tune into SAMHSA's Communities Talk About Prevention podcast series. There you can learn how stipend recipients are advancing substance use prevention in their communities. Each episode features participants from previous Communities Talk cycles discussing how they have coordinated local events and activities to support substance use prevention, overcome unique challenges, and how they have measured success, because it's always important to measure your success. Guests also shared best practices, which we hope will inspire your prevention efforts in your own community. So far, 3 episodes are available on the Communities Talk website and other podcast hosting platforms for listening now. Yes, thank you. In terms of materials and resources, SAMHSA has been working hard to update and release new resources, including the updated Quick Start Planning Guide. The Quick Start Planning Guide will help you and your team work efficiently and seamlessly as you navigate planning prevention activities through checklists. We also have a calendar and detailed steps. We also have a customizable resources for promotion and implementation of your activities, such as ways to engage with the news media, sample social media messages, event introduction videos, a graphics gallery, and more. Next, please. So we also have a learning series. It is an online learning series for prevention professionals. Our first session focused on the importance of developing prevention strategies within the context of the intersection and lived experiences of young people. The second session is an overview of the Communities Talk program, its resources, success stories, and information on participation in the 2023 cycle. Now, both sessions are available on demand on SAMHSA's YouTube page. In terms of prevention resources for IHEs, we feature many resources. These include materials like our Substance Misuse Prevention for Young Adults Guide and the College Drinking Prevention Perspectives video series with its accompanying discussion guides. Each of these offer evidence-based research to support prevention efforts at institutions of higher education. On this slide, I pull some things. If you need something more of the grab and go type, SAMHSA will have you covered. Our fact sheet on college students is an easily digestible resource listing facts on alcohol use among college students. Our eye-catching data visualizations, preventing unsafe drinking behaviors on campus, illustrates how alcohol use among college students in an engaging way to inform colleges and universities. And also, given the staggering trend in alcohol among young women, the alcohol use among girls and young women, a worrying trend fact sheet may also be a helpful resource to support that specific population. Next, please. Also wanted to highlight that SAMHSA has an evidence-based practices resource center that promotes communities, clinicians, and prevention professionals with the information and tools to incorporate evidence-based practices into their communities. Some of those resources have been highlighted here, and I encourage you to visit samhsa.gov/resources-search/EPB for more information. And other federal agency resources include the National Institute on Drug Abuse's College Age and Young Adults webpage, SAMHSA's Youth and College Students tab, as well as the National Institute on Alcohol Abuse and Alcoholism's College Alcohol Intervention Matrix, or the College AIM. They are great resources to support prevention in your communities. So at this point, as we're talking about other federal agencies, I will segue over to Rich Lucey to talk, to give us the DEA perspective. Rich?
Hey. Thanks, Marion, and hello, everyone. I'm really pleased to see there's about 85 of you on the webinar today, so that's a great turnout. So, and I also want to give thanks to Marion and my old stomping grounds at CSAT for inviting me to be part of today's webinar. Anthony, we can go to the next slide. So, you know, we talk about this often. One of the questions I know I and my colleagues here at DEA in the community outreach and prevention support section are often asked if we're at a conference exhibiting, staffing our exhibit, presenting a session, is why is DEA in the prevention space? And I like to say to folks, well, make no bones about it. You know, first and foremost, we are an enforcement agency. That is our primary mission, to enforce the nation's drug laws. But the fact of the matter is DEA's presence in the prevention space started a little bit more than 30 years ago, quite honestly, about a year after Special Agent Enrique Kiki Camarena was kidnapped, tortured, and murdered back in 1985. Our leadership at that time had used that tragedy, as often happens in our field, right? It often takes something really bad or a tragedy to serve as a catalyst for change. And this was no different, unfortunately. With Kiki's murder, that was the catalyst for educating the American public about the costs and consequences of drug use. I think that his high-profile death really brought home to the American public how dangerous drug dealing and the drug trafficking world is, and the people, the men and women of DEA, especially the agents who are out there on the front line dealing with this issue. And so since that time, DEA has steadily increased our resources for individuals, families, schools, especially for colleges and universities. I'll talk about that a little bit later, workplaces and other settings and stakeholders to support them in their efforts to prevent drug use and misuse. Anthony, the next slide, please. I'm glad Marion gave you a bit of a snapshot on current data on drug use among college students, because I always love to start off a session with that because it reminds us of why we are doing the work that we do. But I'm going to use my time to talk about something that is front and center on all of our minds here at DEA, as well as our federal partners, certainly at SAMHSA and at CDC and other places, and all of our stakeholders, and that's the drug overdose crisis. It is a clear and present public safety, public health, and national security threat to every community across America. We are doing everything that we can to keep dangerous and deadly drugs out of your community, but we do need your help. We need you to be educated about the dangers of today's drugs. And as I'm going to discuss, some of these drugs are so lethal that experimenting with them just one time could be deadly. I want to put as a caveat right at the beginning of my presentation here is sometimes we are accused of using scare tactics, which we know don't work, right? I like to tell folks and reframe that for them that this is not a scare tactic. I am presenting facts that are scary. That is a big, big difference. We're in a whole new world, unfortunately, with fake pills and the deadly scourge of fentanyl. So Anthony, the next slide, please. The majority of overdose deaths are from opioids, as we know from our friends and partners at CDC, that more than 107,000 drug overdose deaths occurred over the last year. About 2/3 of them involved synthetic opioids, primarily fentanyl, and about 1/3 of them involved psychostimulants, primarily methamphetamine. Now, I don't know if you've visually seen what a potentially lethal dose of fentanyl looks like, but Anthony, if you go to the next slide, you're about to see it right here. This is approximately 2 milligrams of fentanyl. It's considered to be a lethal dose. We know that fentanyl is about 50 times more potent than heroin. And the fentanyl that's driving this crisis isn't just sold in fake pills. Dealers are mixing fentanyl with other illicit drugs to make their product go further and increase their profits. We've been hearing within the college space, and we also know that this is reflecting in the general settings that fentanyl is being mixed with heroin, with coke. We are hearing anecdotally that it is being mixed with marijuana as well. We haven't seen the specific data on this yet because I don't think it's being really captured necessarily by anybody. But when I talk to my colleagues around the country who are working on college campuses and in the surrounding communities, they are hearing it from their students, and students know best about what's happening, at least on the front lines in their settings, right? We're not with them in the residence halls. We're not with them in their apartments, in their workplaces and such. And so, if the students are reporting it, we have to, take that a little bit to heart. And our labs are certainly checking as well to see what fentanyl is being mixed with. And I'll talk about that in just a moment as well. Next slide, Anthony. So in November of 2022, DEA issued a public safety alert to basically warn the public of a sharp national increase in the lethality of fentanyl-laced fake prescription pills. Now, we don't issue these public safety alerts often. As a matter of fact, there have been 3 public safety alerts issued in about the last 6 or 7 years. The first one about 6 years ago called attention to the dangers associated with fentanyl when it was first emerging as a dangerous and deadly threat, on our nation's radar. The one after that came in the fall of 2021, and that was to warn the public about the alarming increase in the availability and the lethality of fake prescription pills containing fentanyl and meth. And then, of course, the one that was just this past November. And I'll talk about this timeline and basically what we were informing the public about now. So Anthony, on the next slide. DEA's laboratory testing, we have about 9 to 11, I don't have the exact number off the top of my head, labs that are across the United States. And our laboratory testing indicates that about 61%, or roughly 6 out of every 10 fentanyl pills tested, contain a potentially lethal dose of fentanyl. Here you can see, that increase just in the past 3 basically calendar years. There's no regulations on these pills. So fentanyl is literally being added to other products and mixed up and pressed into pills. And the analogy that we like to use, and I know I've heard this in other settings when kind of talking about the strategic prevention framework and the SPIF and the recipes that you want to follow, right, with evidence-based programs. Well, think of that recipe, analogy again, when we're thinking about mixing and baking. When you're mixing up, and my good friend and colleague, and I know Marion's as well, Dr. Allison Smith from the Louisiana Board of Regents talks about this particular analogy. Think about baking chocolate chip cookies, right? And you've got the batter there and you pour in your chocolate chip cookies and you're mixing in the batter, and you want to make sure that the chocolate chips are basically, as even as possible, thread throughout the batter. Well, with the fentanyl being pressed into these pills, there's no telling if a pill contains trace amounts, if it contains a lethal dose, or if it's twice the lethal dose of fentanyl. We hear the same analogy when we talk about edibles, right? It's this whole issue of, without the regulation of, we have no idea how much THC is, within a package of edible gummy bears, or other, how much is in one gummy bear versus another. Same kind of analogy I like to make with the idea of what's being mixed into these pills. Anthony, if you go to the next slide, as I mentioned, 2 milligrams is considered a potentially lethal dose. Today, the average dose in pills tested at our DEA labs is about 2.4 milligrams, and that's over the lethal dose. That's up from just a couple of years ago. It's up from 1.6 just 4 years ago, which was below the lethal dose. So again, you can see in just a short period of time how much this, the average fentanyl dose in tablets has increased. On the next slide, Anthony, please, thank you. What are the most common fake pills? Well, some of the most common are made to look like prescription opioids, like oxy, hydrocodone, Xanax, alprazolam, stimulants like amphetamine, such as Adderall. These fake pills, they're widely accessible and often sold on social media and e-commerce platforms. And as I've been like to say in the presentations that I've been doing, most recently at SAMHSA's Prevention Day and at CADCA's National Leadership Forum, these fake pills are accessible to anyone who's got one of these, the smartphone, right? And so again, not a scare tactic. This is simply accessibility. Let's think back to what we've learned about alcohol misuse prevention, right? It's about access, availability, and changing norms. So the accessibility is a real concern here. Time for your pop quiz. Anthony, if you go to the next slide, you're going to see 2 graphics here of Oxy. And so just take a silent moment, if you will, and try to decipher which one is the authentic Oxy, which one's the fake one. Obviously, I don't have my grading pen out, and you only have 2 choices, so it's it's pretty much a pass-fail. But I'm not grading you on this. But just take a moment to think which one is the authentic one. And Anthony, if you advance, we'll display the answer. So the authentic Oxy is what is on top, which is rather counterintuitive for people, because they think that the one that's at the bottom, which is the more crisper or cleaner one, would be the authentic one, but it's actually the exact opposite. And we have other photos of these, including the authentic versus fake Xanax and what those look like on our website, which I'll point out for you in just a moment. So on the next slide, Anthony, in 2021, the fall of 2021, with the proliferation of the availability of these deadly fentanyl, this is why we launched One Pill Can Kill in our awareness campaign. And at dea.gov/onepill, In the toolbox, you can see all the safety alerts, the public safety alerts, the fact sheets, the graphics that you can use, download, use as you wish, and the social media messaging that you certainly can use as well. Anthony, on the next slide, if you would please. Here is what I like to tell folks, no matter who I am presenting to, the top line universal message that I want people to be using, because it doesn't matter what audience you're talking to. I don't care if it's students in K-12, students in the college setting, employers in the workplace setting, teachers, your parents, your partners, your kids, nieces, nephews, whomever. The top line message is, do not take any medicine that was not prescribed by a licensed medical provider and dispensed by a trusted pharmacy, period. That is the top line message. That is the message that's universal to everyone. Again, keep that in mind. I'm going to show you just a couple of quick examples as I speed through the rest of these slides in the next few minutes. These are just some examples of colleges and universities who have taken the one pill can kill messaging and have run with it, which we're very happy about. And so on the next slide, first up is, oh, sorry, Anthony, go on the next one, is Auburn University. So in the fall of 2021, when we first launched One Pill Can Kill, and that's where the majority of these came about. Auburn University on their Instagram account took the press release, as well as Administrator Milgram's quotes, which is not completely visible. It's cut off a bit on the right side. It's just for cropping purposes of the PowerPoint. You can see the full IHE post, but they started advancing the message across the university system about the drug market being inundated with fentanyl-laced products. On the next slide, Anthony, my alma mater, full disclosure, the University of Albany, our good friend, Dr. Dolores Cimini, and students up there. And I will tell you, a lot of these were student driven and student developed on these campuses. Here they've talked about the awareness that's needed around fake pills, including fentanyl-laced cannabis, as I mentioned earlier, as well as where to get help. This has been on their social media platforms. They've also turned these graphics into large-scale bus shelter graphics. And as somebody who's originally from Albany, New York, and as I know right now, they are buried under some snow, those bus shelters are very nice to protect you from the elements. And so it's nice that on campus and around campus, they can see these. On the next slide, for the wow factor, if you will, the University of Central Florida, in a partnership with the Orange County Drug-Free Coalition, got some funding from them and wrapped their campus police vehicles in the One Pill Can Kill vehicle wrap. High visibility, certainly an attraction. If it's centrally located, I always like to say, the helicopters and the canine dogs, that's what brings in, people and they're brought in and, attracted to whatever it is we're talking about. That's exactly what this is. It can be a conversation starter. I do know the wraps, I don't have the exact cost, but I know that they're fairly low cost and fairly long shelf life. So if your campus police might be interested in doing something like this, let me know and I'll put you in touch who in Florida worked on this. And then lastly, the next slide, University of Virginia. Again, students there in the Gordy Center at UVA developed these messages around One Pill Can Kill. On the next slide, Anthony, and the next few slides, I'll go through these pretty quickly. So we know that the 18 to 25 age group has some of the highest drug use rates, but also some of the lowest rates of seeking help. And college students make up a significant portion of those 18 to 25-year-olds. And not coincidentally, with my arrival here at DEA in May of 2016, it was partly to build up our portfolio of products for institutions of higher education. And so since that time, we have built up a fairly robust portfolio that I'm very proud of. On the next slide, Anthony, you can see we started very small with our 3 fact cards, now 3 fact cards. We released the impaired driving one last summer. On the next slide is our flagship resource, which is campusdrugprevention.gov. That's our one-stop shop, if you will, for all resources related to drug misuse prevention among college students. On the next slide is our big, I'd say top selling, but all of our stuff is for free, but top downloaded publication is our strategic planning guide called Prevention with Purpose, which is about to undergo a light to medium refresh this year. It was released in January of 2020 when the pandemic was on nobody's minds. And so the guide is a bit silent on the pandemic. So we want to make sure that we address that a bit in the strategic guide. On the next slide are the now 10 supplemental resources that reframe the Prevention with Purpose strategic planning guide for various stakeholders on campus. And then lastly, on the next slide is our Red Ribbon Campus Video PSA contest. Thanks to our partners at CSAP, we just wrapped up our 7th annual and be on the lookout for details about the 8th annual. To save the date about that will be coming out this August. And so with that, it's my pleasure to turn this over to Dr. Hagle to talk about PTTC and their resources. Holly.
Thank you so much. I am going to share my screen and I'm gonna toggle between the PowerPoint and just showing you our website live. It's kind of fun, a little, so we can do a little bit of a tour. I just wanted to say thank you to Marion and to the Higher Education Center for having us today. And it's a pleasure to be here and share the great work of the Prevention Technology Transfer Center, which is funded by the Substance Abuse and Mental Health Services Administration. I have to say this is one of my favorite things to do because it's one of the easier presentations. I just get to show you thousands of fun resources, newsletters, webinars, toolkits that you could use that are here to serve your needs. It's much more fun than presenting at research conferences. Thank you for having us. I do want to make a connection with the Higher Education Center and the PTTC Network, in particular my office, the Network Coordinating Office. Dr. Jim Lang has been a founding advisory board member for us and with our office for the last 4.5 years. I'm going to tell you about the PTTCs in a moment, but we are in 5-year grant cycles, and I'll share our structure. And when we reached out to Dr. Lang, he really didn't know us. So I appreciate his faith in us and the advice that he's given us in our advisory board. And I'll tell you more about our advisory boards in general. Every PTTC center has an advisory board, and they're just really key to helping us understand the needs of the prevention community. We share audiences, but we're not the same audiences. Sometimes they're intersecting, sometimes they're shared, but we do have a similar mission to advance the prevention field. So thank you to Dr. Lang. So SAMHSA funded the PTTC, the Prevention Technology Transfer Center Network, in 2018. We're a 5-year cooperative agreement, and we are funded to improve the implementation and delivery of effective substance use prevention interventions across the entire prevention field, which we know is very, very diverse, right? It's institutes of higher education, it's prevention coalitions, it's community police forces, it's hospitals, it's doctors, it's schools, right? So we have a very, very diverse field, and I'm just so pleased to work with the network. In the last 4.5 years, we are in the 5th year of our grant cycle that has developed so many wonderful resources that I'm about to share. But the core of our work is we do training and technical assistance for that prevention field that I described. How do we do this, you might be thinking? Well, we develop and disseminate tools and strategies to help improve prevention efforts across those various stakeholders. We provide intensive technical assistance and learning resources to help the field's understanding of prevention science, use of data, which I'm very happy that you guys, Marion and Rich, talked about the actual data that's going on within our communities right now. And we really try to take the evidence base from the research, bring it into practice, but also look at promising prevention practices with the prevention communities, linking to the researchers and implementing them in our communities, in our schools, in our organizations. And we do that by developing tools and resources. Another big thing that the PTTC does, our target audience is the prevention field in and of itself, we are really trying to lift that next generation of prevention professionals up, and I will share some of our outreach and engagement activities, especially you guys are working with that next generation. So I hope that prevention, being a prevention professional, and some of the things that we're trying to do across the country fit into the things that you are doing on your campuses. Okay, so here's our structure. We are comprised of 10 US regional centers, and these 10 centers line up to the Health and Human Services 10 regions. So I'll show you a map in a moment. So every state and US territory has a PTTC. And we also have 3 national centers, 2 that are population focused, a National American Indian and Alaskan Native PTTC, a National Hispanic and Latino PTTC, and then my office is the coordinating office. So you can see the beautiful pictures that depict the regions here, and then I'm going to share the map. And the map just shows the HHS regions by color coding, and where each of the parent organizations are for the PTTC centers. So I work for the Network Coordinating Office. I'm here at the University of Missouri, Kansas City. But we also are in Region 7, HHS Region 7, or the Mid-America PTTC, that the cooperative agreement is to the ACT Missouri. So they are our regional PTTC. And likewise for Region 4, Southeast PTTC is at Wake Forest University, and so on. You can see on the map. I am going to put in the chat here a link, and I know that Anthony posted a link to all of our PowerPoints, and all of the links are live links. So you can get all of the resources presented by all 3 of us today by clicking on those links. But I wanted you to also have access to our website. I am going to do a tour very shortly here. What else do I want to say? Again, the territories are represented, every state and US territory. So if you don't know about your PTTC before today, you can't go home at the end of today and say you did not hear that you have a PTTC where you live. And the beauty of our network is that we can scale up and work across the entire country, but we also zoom in and work within our region. So we do work within our states, and then drilling in further than that, we work within each state, and we work within, each of the localities in the state. And that is just a very beautiful model, because we can also leverage resources across topic areas with that model. That's why we have a network coordinating office. That's our role, which is to talk to stakeholders like you, connect you to your regional centers, but also to pivot the network to look at the existing topics within the prevention community that is of importance. So I'll share our work groups who do that very shortly. So here we go. I've talked this up a couple times now. I was going to talk to you about our website and give you an actual tour. So the PTTCnetwork.org, which I put in the chat, you can find your regional center. Let me go to the website now. It's just fun to toggle there. We hope we have a user-friendly website, but it has a lot of information. That's why I do like to tour it. So we have a search button right at the top, and I just put in college because you're our target audience for this webinar. And I thought, let me just show you what you could just do. If you just go to our landing page, you put in a keyword of interest, you can see it does search by topic of college and all of the resources that we've put together that have the term college in it, and from the regional centers or national products that might come out from our work groups. So I thought you would find, just the functionality of our website interesting. We have, here we'll feature some of our larger initiatives. So these sliders, change every so often, but you can just scroll down and get connected with the regional centers. These change, each of the featured pages change to the latest products that the regional centers are developing. And then we feature one every. But again, to reach your regional center, you come to your PTTC and you can pick whatever your state or territory is. Now, you're not limited to that. If you're in the Central East region, and say you live in Virginia, it doesn't mean you can't look on the Great Lakes and get their resources too. Especially now that we are in this digital environment of Zoom, we have been for the last 3 years. We have cross regions. So I don't mean to convey that you have to stay to your region. it's just nice to connect to your region because they're doing live face-to-face trainings. Now face-to-face is back. And each PTTC has an advisory board. Getting connected, like Dr. Lang with advisory board, is a really good way to connect with SAMHSA. We have annual work plans that we have to submit, and our advisory board gives us the guide to what is happening in the field and on the ground, and we put that in our work plan and submit it to SAMHSA. So that is sort of the beauty of what I was talking about, of how we can scale up nationally, pivot to projects because we have this regional model. And the national centers are just that for everybody. But all of the regional centers are open to you, all the resources are open, but you should connect to your region so that you can get that local level too. Okay, let me go back to my PowerPoint here. So when we were first funded by SAMHSA, the Network Coordinating Office, my office, we did an analysis of all of the applications that were awarded because each of the awardees had to identify a focus area of expertise. And what we did was we took those focus areas and we collapsed them into themes and we created work groups. And I have to say, it's one of the single most important things we've done because it was kind of economy of scale. Instead of 10 centers working independently on their focus area, we decided to collaborate and work across these topic areas in 6 work groups. So these work groups are very, very robust. And under them, they have a ton of products. I'm going to share a couple examples that we picked out that we thought were relevant to this audience of higher education. But community coalitions and collaborators is working at all levels of the community. So with coalitions, but also with hospital systems, with your local, stakeholders, maybe in a community health board. Our implementation science group has a lot of good resources that are probably very targeted to this audience. So I do have a few examples. When we first started, we didn't have the cannabis prevention back in 2018, 2019. We had an opioid prevention group. That group was together, work group for about a year. And then there's a lot of opioid TA. We happen to do one of those centers here at the University of Missouri, Kansas City. So we heard from the field with a lot of the cannabis legalization changing across the country that we should have a cannabis prevention, and we stood that one up. So the other one is workforce development. That is our bread and butter, right? To try to build capacity in our workforce. And so we have a workforce development committee. So again, if you go on our website, you can see under our projects, each of these priority areas, and you can see the products that they have developed related to that topic area through the work group. So all of the work groups are very productive. I can't say that one is more productive than the other because they all are. Our data, it's just amazing to me. And I do think it's the beauty of prevention. I think prevention naturally is collaborative, but it's also the economy of scale that I talked about. We can work on our regional priorities and we can share them and within our region, but also across the country. So that is our projects, some of our priority areas I wanted to share with you. So let me go back to my PowerPoint here. So here's some of the resources that we picked out that are relevant to this webinar, and I will leave us time for questions. So I saw a couple hit the Q&A panel. Marion mentioned that SAMHSA has their evidence-based practices resource page, which we promote as well. But I don't know about you guys, but I can literally have a discussion for an hour on registries, just alone, the science of registries, how registries work. But maybe in the coalition world, they're not interested in looking at the science of registries. So our implementation science work group went ahead and created these products to help the field understand why it's so important to know the evidence before you go and implement it at the community level, right? So these are some of the products, and just talking about and understanding evidence-based registries has been consolidated down to this product that this work group worked on. We thought would be a connection to you. And again, Anthony put a link to the PowerPoint. So all of these links are with these recommended resources are at your fingertips. Other PTTC resources that we thought you would be interested in, tools around successful implementation and sustainability. for communities that are trying to implement evidence-based practices and how you create that balance, working and understanding and adapting evidence-based to minoritized or vulnerable populations, and also coalition buildings. And you will see that my team prepared these slides. They wrote tons because we have a lot of coalition. And I think in Rich's examples, which were so wonderful, you mentioned that coalitions working with the Institutes of Higher Education. So understanding these coalition resources might be relevant to your work as well. So that's why we pulled it. Let's see. Okay, so products, I'm going back to our website to just do a little demo. So I talked to you about our projects where you can sort through those work groups. Under resources, we have a specialized resource that's to that work group, but here's our products and resources catalog. It is searchable by just keyword, or you can narrow it down by product type. Or if you're interested and you know a particular center has it for a product, you can look by center and you can look by audience. And we have, just some pre-selected choices here. So our database really just, we're just trying to make sure you have access to all the resources of the entire network, right? So that you're not restricted to the one, but you have access across topics or population or audiences. And I should mention before I go back to my PowerPoint that it's the same for our training and events. It's a database and you could search it by keyword, by center, by past events, because a lot of them have been virtual. We've been able to archive them, things like that. Okay, here we go. I'm wrapping up, guys, so we have time for questions. Keep in touch. I know we talked about a lot. You have the PowerPoints, but you should also sign up. I'm not shy to say I love this newsletter, and subscribe to the PTTC Post. Our national office, the network office, publishes this, and we link to regional centers. Regional centers too have, not all, but some of them have their own newsletters that focus on regional activities. I will go to the website again and show you. If you look at like our current issue, you can see that we, feature regional products and national products that are targeted to our topic for that month. We do 12 issues, they're topical, and then we make sure to link to our funder, SAMHSA, but also other collaborators, like all of the national prevention state directors through NASDAD and other organizations that collaborate with us. So we really do want you to be able to use these resources to make them targeted to your needs. I think that's my last slide. Of course, follow us on social media. Every time I'm at a conference, I try to post a little cute things here and there. And I think we're ready for questions now. I know we have 5 more minutes left.
Yeah. Next slide, please.
Okay. Oops, I think I have to stop sharing, and I think it's going back to Anthony.
Yeah, I can put your contact information up, and as Dr. Hagle has shared, that now is the time for questions, and it does look like we do have one question, and it does appear
I
for you.
see that.
It's a question for Holly.
Are we having a conference in San Diego? Well, first of all, San Diego is my favorite city. You wouldn't know that. But when I have a chance to pick a training event, I usually pick San Diego. So chocolate. We have, not that I have a top of my mind, the regional, the Pacific Southwest PTTC, which is California, is there in that region. They might be doing a local event. I can look in the training database as we look at other questions, but maybe you might have heard of an event we're having in Los Angeles in April. Now, I do know this for a fact. We're hosting an introduction to the prevention core competencies training for our prevention fellows in Los Angeles in April. I'm not aware of a training in San Diego, but that does not mean that the Pacific Southwest is not hosting an event local to San Diego or the state of California.
Okay. Thanks, Holly. And thanks to John for asking that question, because it reminded me to ask you and Rich, and I'll take this moment to do a shameless plug for SAMHSA about upcoming and exciting events. One thing that is on the top of my mind is National Prevention Week. National Prevention Week will be held May 7th through 13th of this year. It will be an opportunity for people to learn about all things prevention. You will find out what is new and exciting, such as what is going on with the Talk They Hear You initiative, to see what new materials and resources that we have at SAMHSA. And also it will be another opportunity for me to talk about Communities Talk. So with that plug out there, Rich, what is there something that you would like to share about what's next and new at DEA?
Well, I would want to let people know that the next National Prescription Drug Take Back Day is scheduled for Saturday, April 22nd. It's 10 a.m. to 2 p.m. local time. As we've done for the past several years, DEA is collaborating with its partners at IHE, which are the campus law enforcement administrators, as well as NASPA, the student affairs professionals in higher education. We should be releasing a letter soon in the next couple, 3 weeks, encouraging colleges and universities to be part of Take Back Day. If not as a collection site, which does require law enforcement presence, then to collaborate with your local municipal prevention coalitions and law enforcement to participate in the community version. But yeah, that's certainly coming up, and it certainly fits in with the whole issue around fake pills and getting rid of unneeded, expired medications.
Oh, you're muted, Marion.
Thanks, Holly. I'm checking the Q&A box, Anthony. I think Holly and Rich did such a phenomenal job. They answered everyone's questions. And I had the opportunity to do a shameless plug for SAMHSA. Is there anything else that, thank you, Linka, for your comment about the resources. We are excited about the materials that we currently have and that are in production. And also some of our materials we are in the process of updating because we use some NISDA data, and as you know, it changes on a yearly basis. So that keeps us busy and on our toes. So we are updating those to make those fresh and cutting edge. At this point, I would like to again just thank Rich and Dr. Hagle for joining me when I was asked by OSU to put this together. My initial thought was, what stellar colleagues can I bring aboard to help talk about what's going on in prevention, and that people would find exciting. And so thank you to both of you for presenting with me, and also thank you for those who joined us, because otherwise it would be just a conversation amongst the three of us, but it's more exciting when we have people who are interested in the work that we are doing. So thank you. And if you think of a question, as people do from time to time after we're gone, please reach out to us and we will be in touch. Anthony, unless you have anything else to add, I will close with a thank you to your team and wish everyone a great day.
That is all. Thank you. A big thank you from us at the center to all of our presenters. Thank you for covering a ton of material and sharing of yourselves and your resources. We know how valuable that will truly be to our audience. And of course, thank you for sharing your emails just in case questions do arise after today's session. I do just have a couple of housekeeping slides. Again, just a reminder that we have a free webinar happening next month on April 13th and is featuring Dr. Karen Moses and is titled Using Data to inform prevention planning. And of course, we have the 2023 national meeting happening at the end of June, June 25th through the 28th in Columbus, Ohio. And early bird registration ends this week on Friday. Just a friendly reminder that today's session has been recorded and you can expect to see it uploaded to our website along with the resources that were shared within 3 business days. Thank you everybody for joining us, and we hope to see you next month for our next webinar. Take care all.